develop symptoms that show that they are intolerant to this lactose, a type of sugar that is found in milk or dairy products. Okay, so when one is unable to digest this lactose, they develop symptoms related to the indigestion of lactose, and therefore the intolerance results.
Okay.
Yes.
So, Daktari, what causes that intolerance? That is that lactose cannot be able to be digested. What causes it?
Now, viewers, we need to understand that lactose, as we've said, is a compound sugar. This compound sugar is found in milk. Let us limit ourselves to milk. Now, when one ingests or takes in milk, it is supposed to be broken down. This complex sugar needs to be broken down. And it is normally broken down via the intestines, producing a type of enzyme called lactase. We are talking of lactose as the complex sugar, and lactase as the enzyme that is necessary for the breakdown of this lactose. And when this lactose is broken down, it normally gives off glucose and galactose. Okay, so if this milk is not broken down, this sugar is not broken down, it remains lactose as it is, and this is a compound sugar which cannot be absorbed unless it is broken down into these two, glucose and galactose. It cannot be absorbed. The body, the intestine, the small intestines cannot absorb it, and therefore it passes through the stomach, through the small intestine, into the large intestines, just as it is. So when it gets to the large intestines, then it finds that there are bacteria in the large intestines that work on this complex sugar. Okay, these bacteria, as they work, these are normal flora bacteria, by the way. They are not bacteria that are causing disease. They are bacteria that are necessary in our gut, in our large intestines. Okay, so when this lactose gets to the large intestines and it finds the bacteria there, the bacteria act on the complex sugar, the lactose, and therefore it gets fermented. As it ferments, then the symptoms do result. Now, as we go by, we may want to know, why is it that this person is not able to produce lactase? Okay, why is he not able to produce lactase? And so, as we shall be looking at the different types of lactose intolerance, maybe we shall be mentioning why it is occurring that this person is unable to produce lactase, and therefore they are not digesting lactose, and therefore the symptoms are resulting. Okay? Yeah. So the cause actually is the lack of lactase that is necessary for digestion or breakdown of lactose.
So that is basically what causes lactose intolerance.
Exactly.
Okay.
Yes.
So do we have the types of lactose intolerance maybe?
Yes, there are.
Yeah.
There are majorly three, but they can be called four. One, we have what we call primary lactose intolerance. Under primary lactose intolerance, this is where one is not producing, for one reason or another, unknown reasons, one is not able to produce lactase. Okay? Yeah. Therefore, they are either born with this an inability to produce lactase. Okay? So, primarily, there is no cause that you can attribute to the lack of or the low amount of lactase that is necessary for digestion of lactose. Okay? In primary lactose intolerance, one apparently does not produce lactase for no known reason. Okay, and eventually the lactose that they take in via the milk is indigested. So that is primary lactose intolerance.
Okay.
Primary lactose intolerance. Of course, if we have primary, we have secondary, but we do not have tertiary. Okay, so our secondary lactose intolerance. When one has secondary lactose intolerance, it means that they were born normal. They were producing enough lactase necessary for digestion of lactose. Okay, but because they underwent maybe an operation, or they suffered a disease that caused their small intestine. By the way, lactase is produced in the small intestines.
Yeah. Good.
Okay?
Yeah.
So because maybe they underwent an operation that took part of their small intestines off, then they are unable to produce enough lactase. Okay? Now, or they suffered a disease, any disease that is affecting the small intestine that can lead to a death of the cells that are necessary for production of lactase,
Yeah.
and therefore it results. They were born normal. They used to produce enough lactase, but because they fell sick, their intestines fell sick, then they are unable to produce enough lactase. And or they underwent surgery, and therefore their part of their small intestine was resected or removed, and therefore reduction in the production of lactase results. This is secondary lactose intolerance. We've talked of primary, secondary. Another one is congenital. Congenital means when you hear anything said congenital, be it a deformity, a body deformity, or any disorder that is mentioned as being congenital, it means one is born with this. Okay? So for one reason or another, during maybe their development, one is born with this disease, with this abnormality. Okay? It could be because maybe they are premature. They were born premature. And when they are born premature, it means that they are not yet developed. Their intestine is not developed to an extent where it is producing lactase. Okay? So congenital lactose intolerance means that one is born with this abnormality. They have an abnormality. Perhaps the cells, in one way or another, during the development of the intestinal cells, the cells did not develop well enough to be able to produce lactase. So they are born with this abnormality, congenital. We talked of primary, we've talked of secondary, and now we are talking of congenital.
Yeah.
Okay, having talked about these three, the one that I say that is now the fourth one is called familial. Familial means that this thing is running in a family. And as many other diseases do run in families, again, it's not unusual to find lactose intolerance running in a family. In one way or another, this family has a kind of disorder in their cells of the small intestine that they are unable to produce enough lactase. Okay? So you find the same being passed on from one family to another. But this one requires that the mother and the father have this recessive gene. Okay? Recessive gene means that the mother donates a half, and the father donates the other half. It makes a complete gene that now is passed on to the newborn, and this newborn is unable to produce enough lactase.
Yeah.
Okay? So familial it means that it is running in a family. It's not abnormal for us to find that a particular family is suffering from lactose intolerance. Viewers, we are not talking of just some languages that maybe are difficult to understand. What we are saying is mgonjwa akiwa na ugonjwa wa lactose intolerance ni yule mgonjwa ambaye anapotumia maziwa au vitu vyovyote vinavyotokana ama vyakula vyovyote vinavyotokana na maziwa, hana uwezo wa kuyasiaga hayo maziwa ama kuyavunja mpaka ifike kiwango ambacho mwili unaweza ukayatumia. Na tumesema kwamba maziwa huwa yako na aina fulani ya sukari ambayo inaitwa lactose. Hii sukari isipovunjwa vizuri itapita tu katika mwili ikiwa imebaki imeshikamana. Na inapofika kwenye utumbo mkubwa huwa inakutana na bakteria ambazo ni kawaida ziko ndani ya miili yetu na zinahusika katika digestion na afya ya mwili yetu. Hizo bakteria sio zile za kusababisha magonjwa. Kwa hivyo inapofika pale inakutana na hizi bakteria na inafanya kuwa chachu. Inapofanywa kuwa chachu, mtu huanza kuhisi dalili za kuonyesha kwamba mwili wake hauwezi ukastahimili sukari ambayo haijasiagwa. Sawa sawa. Kwa hivyo what we are saying is that kuna aina 4 za hii hali ya lactose intolerance. Ya kwanza inaitwa primary. Mtu alizaliwa na sababu za upungufu wa lactase ambazo hatuwezi tukaeleza ni kwa nini. Ya pili, secondary, kumaanisha umekuwa mgonjwa alafu ukawa na hii shida upungufu wa lactase. Ya tatu ni kusema kwamba mtu amezaliwa na hiyo shida. Okay? Na ingine tumesema kwamba mtu huwa inaweza pitishwa katika familia moja, mama na baba wanapitisha kwa mtoto wake.
Yeah. Asante sana daktari. Okay. Natumai hapo mtazamaji umeweza kuelewa sasa kuhusu hii hali ambayo tunaongelea, hali ambayo inaitwa lactose intolerance. Na tukiwa tu hapo daktari, labda nikuulize swali, labda mtazamaji anajiuliza swali, hii congenital lactose intolerance, huwa unajua sasa mtoto akishazaliwa anahitaji maziwa, ananyonya maziwa. So inaanza hapo baada akishazaliwa tu hiyo hali inaanza, ama mpaka baada ya miaka fulani?
What we are saying is that this condition usually one is born, they produce enough lactase, but maybe at the age of 4 years. At the age of 4 years, they begin to exhibit the same symptoms of lactose intolerance. So they produce lactase, but as time goes by, it
decreases.
Yes, it decreases.
Okay.
Yes. So it mostly gets evident at the age of 4 years and above. Yes.
Yeah.
Okay.
Yeah. Thank you very much. So ni watu gani ambao wako katika, ama ni kundi gani la watu ambalo liko katika hatari ya kupata hali ama ya kuwa na hali kama hii ya lactose intolerance?
Now viewers, we are talking about the risk factors for us or one getting or the circumstances into which one finds themselves and they can suffer from this abnormality or digestive abnormality. So the risk factors for lactose intolerance include advancing in age. When one advances in age, many degenerative things do occur into our body. Degeneration takes place naturally. Okay, and amongst the things that our bodies are unable to sustain include the production of lactase. Okay, so as one advances in age, they are at risk of developing lactose intolerance. Okay. Another thing is prematurity, as I had alluded to earlier, that when one is born premature or when a baby is born premature, it means that their intestines are not developed maturely enough to be able to produce lactase. Okay, so prematurity is a risk factor for lactose intolerance. Okay, until maybe they are kept in the incubator, they stay there for that while, and then as they mature, they may overcome this intolerance. Okay, another thing is when one ethnicity is a factor, a risk factor, and it is said that when we talk of ethnicity, it means that from which ethnic affiliation are you? Okay, it is said that this lactose intolerance is more common in Africans, in Asians, and Hispanics, and less common in Europeans. Okay, so ethnicity, by the virtue of us being Africans, it is we are at risk of suffering from this lactose intolerance. Okay, including the Asians, the Hispanics, and those people from South America. But the others from the North America and the Europeans have less occurrences of lactose intolerance. Okay, another thing is that there are some diseases that affect the GIT, the diseases that affect the gastrointestinal system or tract, including a disease like Crohn's disease. Crohn's disease again is a condition in which there is a repeated inflammation of the GIT, repeated inflammation of the GIT, and so this inflammation affects the small intestines, and therefore production of lactase can be an issue. Another disease is celiac disease. Celiac disease again is also a disease of the digestive system in which people are unable to tolerate. It is actually an inflammatory response that occurs in people who are unable to tolerate a kind of protein that is called glutamate that is found in wheat. So when one is suffering from this disorder in which they are unable to tolerate glutamate, an inflammatory response results. When inflammatory response results, the cells of the intestines get sick, or they get affected. As they get affected, they are unable to produce lactase, and therefore lactose intolerance results. Okay, so another thing is when one is suffering from cancer and the treatment that follows cancer, especially the chemotherapy that is used for treatment of cancer, as it kills the abnormal cells, cancerous cells, it also may kill the normal cells of the small intestines that are necessary for production of lactase. Okay, so one who has been undergoing treatment for cancer with chemotherapy or even radiotherapy, they can also suffer from this lactose intolerance. So viewers, again, in summary, we've talked of age, where age, you said, as one advances in age, they can suffer from this lactose intolerance. Those people who are born prematurely can suffer from lactose intolerance. People who are of African origin, as we are, can suffer from this thing. This is ethnicity. Diseases that affect the digestive tract can cause lactose intolerance. And similarly, if one has undergone treatment for cancer, they can have their cells being damaged, and therefore the cells become unable to produce lactase, and therefore lactose intolerance results. Yeah.
So all these are risk factors of lactose intolerance.
Exactly, those are the risk factors.
Na mtazamaji, umeweza kusikia vile daktari ameweza kuongelelea kuhusu haya makundi ya watu ambao katika hatari ya kupata hii hali ambayo tunaita lactose intolerance, na ameweza kuzungumzia kuhusu umri. Anasema kwamba wakati umri unazidi kwenda kupanda ama kwenda juu, basi ndio mtu anaweza kuwa katika hatari kubwa ya kupata hiyo hali ya lactose intolerance, ama kutosagika kwa maziwa ama ile sukari ambayo inapatikana kwa maziwa ambayo inaitwa lactose. Na pia kundi lingine ambalo ameweza kulitaja ni wale watoto ambao wanazaliwa kabla ya miezi yao 9 haijaweza kufika. Tunaitanga premature, ama tunaweza sema prematurity babies. Pia hao wako katika hatari ya kupata hiyo ama kuwa na hiyo hali, kwa sababu unakuta kwamba yale matumbo yao hayajaweza kuumbika vizuri
kabisa, hayajakomaa
vizuri sana, hayajakomaa. Kwa hivyo ile enzyme ambayo inaitwa lactase, ambayo ndio inavunja ile sukari kwa maziwa, itakuwa hakuna. Kwa hivyo hilo ndio kundi pia ambalo liko katika hatari ya kuwa na hiyo hali ya lactose intolerance. Kundi lingine la 3 ameongelea kuhusu ethnicity. Ethnicity ni kumaanisha tunahitaji kwa Kiswahili ethnicity?
I don't know. If you ask me, wewe ni Mwafrika, wewe ni mzungu, wewe ni Mhindi, ama wewe unatoka wapi?
Kwa hivyo ameweza kusema kwamba Waafrika sana sana na wa Asia na wa Hispania, hilo ndio kundi kubwa la watu ambao wako katika hatari kubwa ya kuwa na hiyo hali ya lactose intolerance. Na nyingine pia, kundi lingine ambalo ameweza kuzungumzia ni kundi ambalo liko na magonjwa kama vile kansa, ambapo sasa unakuta kwamba wagonjwa wa saratani sana sana, na kama ni saratani ya matumbo, inabidi sasa apokee matibabu. Kuna ile matibabu tunaita chemotherapy, ambapo tunatumia madawa, na matibabu hayo huwa inasababisha kwamba zile enzymes ambazo zinaitwa lactase, na ndizo hizo zinasaidia kuvunja hiyo sukari, zitakuwa zimekuwa affected na haziwezi kuwa kutengenezeka sawa sawa. Na pia kuna ile radiotherapy kwa wale wagonjwa wa saratani, ile kuchoma zile seli za kansa kutumia miale. Kwa hivyo pia hiyo yote nayo pia inaathiri utengenezaji wa lactase. Kwa hivyo haya yote ambayo tumezungumzia ni makundi ya watu ambao wako katika hatari kubwa sana ya kuwa na hiyo hali ya lactose intolerance. Kwa hivyo tutachukua muda wa mapumziko tu kidogo, alafu tutarejea tena, na tutakaporejea mtazamaji wetu tutakuwa tunazungumza kuhusu dalili za hali hii ya lactose intolerance, pamoja na vile tutakavyofanya diagnosis ama kuangalia, kufanya uchunguzi wa huu ugonjwa ama hiyo hali, na pia tutaangalia tiba ya hiyo hali. Na kama nilivyokueleza ni kwamba unaweza ukatuliza maswali. Kuna namba hapo kwa runinga yako ama TV, unaweza ukatutumia ujumbe mfupi, ama unaweza ukatutumia ujumbe kwa WhatsApp ukiuliza swali lolote kuhusu ugonjwa wowote, ama unaweza ukatuuliza swali kwa Facebook page yetu Heaven Bound TV, na bila shaka tutakufikia moja kwa moja, mimi nikiwa na mwenzangu hapa Daktari Levi Mkole. Kwa hivi kita kambi nasi, usibanduke, tutarudi tena.
That is against God, against the Lord Jesus Christ, and opposed to so many things that you and I believe. So we have to decide, am I going to live by my emotions? Am I going to live by what other people are doing? Or am I going to live by the one thing that I know will absolutely give me clear, true guidance every single day of my life?
4 decades ago, we started In Touch Ministries to lead people worldwide into a growing relationship with Jesus Christ. Throughout the years, we've seen God's greatness, His love and His blessings in such awesome ways that we just want everyone to know Him.
Each new day is a new opportunity to improve yourself. Take it and make the most of it. Join me, Charles Chege, every day from 5:30 a.m. to 6 a.m. on HB Fitness Show as we take the opportunity in making our bodies fit. HB Fitness, healthy mind in a healthy body.
Every day, a life is lost as a result of one disease or another. But we count on the number of lives which are saved. That is why here in Health Booth, we will be educating each other on how to live a healthy lifestyle. Join me, David Ngure, every Wednesday from 8 p.m. to 9 p.m. as we will learn more about our health.
Tangu mwishoni mwa mwaka jana, homa ya virusi vya corona yaani COVID-19 imeibuka kuwa tisho kubwa la kiafya. Maambukizi ya homa hii yameenea ulimwenguni kote, wala hakuna aliye salama. Serikali kupitia idara ya afya imeweka mikakati, miongoni mwao ikiwa uchunguzi wa homa ya corona miongoni mwa wasafiri katika mipaka yake yote kote nchini.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
Inatisha kufikiri kukohoa tu kidogo kwa mazingira haya unaweza sababisha mlipuko wa homa hii usio na kifani. Ili kuzuia haya, serikali imeweka mikakati tosha kuhakikisha usalama wa Kenya wote.
The facility has all the equipments you need from handling a basic patient up to ICU setting.
Hata hivyo, wewe pia unalo jukumu katika kusaidia kuzuia kuenea kwa maambukizi.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu lazima ni sanitize mikono.
Sisi kama taifa tumepata kukumbana na changamoto nyingi na kali maishani, na kila wakati tumeibuka washindi. Hii homa ya COVID-19 hata kama inatisha, si tofauti nazo. Komesha corona. Zingatia maagizo kutoka Wizara ya Afya. Nawa mikono jinsi inavyostahili.
Iron sharpens iron.
And as a father, have you ever thought the best gift you can give to your lineage?
Life is not about the gifts we win. It's about the people we love.
Catch us every Tuesday from 8 to 9 on Elders Council,
a show where all men issues matter.
Life is a series of experience, with the good and the bad, mountains and valleys. And in all our experiences, we need the Word of God. Life in the Word is a program that is derived to encourage you to study the Word of God, that you may be able to interact with the Word of God, and that it may help you grow spiritually. And so every Saturday evening from 8 p.m. to 8:30, tune in for Life in the Word, and you shall be encouraged. God bless you.
Mtazamaji wangu, karibu tena katika kipindi chetu hiki cha Health Booth. Tunaongelea mada ya leo ambayo ni lactose intolerance, ambapo tumeweza kuona ya kwamba hiyo lactose intolerance ni hali ya kwamba ile lactase ambayo huwa inasaidia kusaga ile sukari ambayo iko katika maziwa itakuwa hakuna. Tumeongea kuhusu aina za lactose intolerance, tumeongea kuhusu yale makundi ya watu ambayo wako katika hatari ya kuwa na hiyo hali, ama tunaweza sema risk factors. Kwa hivyo daktari, tunataka tena mtazamaji wangu ajue dalili za hiyo hali ya lactose intolerance. Yule mgonjwa mwenye lactose intolerance atakuwa na dalili gani za kuonyesha kwamba hiyo ni lactose intolerance?
Viewers, the symptoms for lactose intolerance is what we are talking about, and I'm sure at one point or another you have suffered from this thing that we are calling lactose intolerance, and it is usually sometimes temporary, but for those that we are the serious cases, it is sometimes permanent. Okay. And the symptoms is that when maybe you suffered from it, you felt what we are talking about. It may include abdominal pain. Have you ever taken a milk product, or you have taken a packet of milk or a glass of milk, or taken just fresh milk, and you suddenly feel abdominal pain? Okay, this abdominal pain could be occasioned by this lack of digestion of this lactose. Okay, and therefore one symptom is abdominal pain. Another symptom is diarrhea. I once heard of a story of somebody who's being said that he's so sick to an extent that they take in milk, they pass milk out.
Yes,
okay? I've also heard of the same.
Yes, I've heard of the same.
Okay, it means that this milk is just going through the system without digestion.
Digestion.
Yes, they are passing it out as they took it in. Okay, so this diarrhea may be because of indigestion of this milk, because of lack of lactase.
Lack of lactase.
And therefore lactose intolerance can be exhibited by abdominal pain or diarrhea. Okay. Another thing that is common is what we call flatulence. Flatulence means that there is a lot of gas as the bacteria are acting on the acting and fermenting the milk. Or the lactose that is not broken down, very many gases are produced. Okay, the byproducts of the digestion of fermentation include production of gases. Okay, and so these gases cause what we call flatulence. Okay, one passes a lot of flatus. Okay, okay. The three are the most common signs and symptoms for one who is undergoing lactose intolerance. Okay. However, there are some also uncommon symptoms that may be exhibited, and this include distension of the abdomen. Okay, this distension of the abdomen is as a result of the gases that we are talking about. Not every person who is suffering from this lactose intolerance will have a distended abdomen. Okay, but to some people, the gases are so much that the distension results. Okay, another thing could be bloating. Viewers, when we talk about bloating, is where you are feeling tightness, abdominal fullness. Okay, abdominal fullness, and this is again because of the gases that are being produced. The abdomen is distended, and it is feeling like it is full. Yeah. Okay, yet you have taken quite a little amount of food. Okay, so this distension and bloating, and even this bloating, the distension can also result into nausea. Okay, you feel like you want to vomit. So bloating, distension, and nausea are rare symptoms, but they can also appear or occur in one who has lactose intolerance. Okay, so we said the three common ones are abdominal pain, flatulence, and diarrhea. Abdominal pain, flatulence, and diarrhea. The rare symptoms include bloating, distension, and nausea. Okay, so those are the signs and symptoms for one suffering from lactose intolerance.
Okay.
Yeah.
Na mtazamaji, umeweza kusikia daktari vile alivyoongea. Tunaongelea kuhusu dalili za mgonjwa ambaye akona hii hali ya lactose intolerance, na tumeweza kuona ya kwamba dalili mojawapo ya hiyo tatizo ni abdominal pain, yani kuumwa na tumbo, maumivu ya tumbo. Na dalili ya pili pia ni diarrhea ama kuendesha. Yule mgonjwa atakuwa anaendesha kwa sababu ile sukari ambayo kwa maziwa ambayo ameyakunywa haijasagwa. Kwa hivi atakuwa na hali ya kuendesha. Na hali nyingine pia dalili nyingine ni flatulence. Flatulence ni ile hali ya kupitisha hewa kwa upande wa nyuma. Ya hizo pia ndo dalili za hiyo hali. Na pia kuna dalili zingine ambazo hazijitokezi sana kwa wagonjwa, zinajitokeza tu kidogo, ambapo kuna distension, yani tumbo inafura, inapanuka kwa upana, na kuna pia bloating, ambapo sasa tumbo itakuwa imejaa. Mgonjwa atakuwa amekula chakula kidogo lakini atahisi kwamba ameshiba.
Exactly. And they can also burp. Burping is like the belching. Okay?
Yeah, exactly.
They feel like burping when they are suffering from bloating.
From bloating.
Yeah.
Alafu pia kuna dalili nyingine ambayo haijitokezi sana ambayo ni nausea. Ile hali ya mgonjwa kuhisi kama anataka kutapika. Kwa hivyo hizo zote ndo dalili za kuonyesha kwamba huyu mgonjwa ako na shida ya lactose intolerance. Lakini kama vile daktari wangu alivyosema hapo mwanzo, ni kwamba hizi tatu ndio sana huwa zinatokea kwa wagonjwa. Na hizi zingine ambazo tumemalizia si lazima ziwe. Ndio ujue kwamba mgonjwa ako na lactose intolerance. Kwa hivyo daktari, unaweza kutuelezea jinsi ya kufanya ukaguzi ama kufanya diagnosis and test? Ni vitu gani ambavyo mnafanyia mgonjwa ndo tuje kwa conclusion ya kwamba huyu mgonjwa ako na lactose intolerance?
Okay. Once a patient comes to us complaining that they are feeling the symptoms that we've talked about, then they have to, of course, first of all, we shall listen to the history. They'll tell us that immediately they take milk, maybe a short while after they have taken milk, maybe a half an hour or even up to 2 hours after they have taken milk, they experience abdominal pain, they feel like they diarrhea, they feel like there's so much gas into their abdomen. Then this is the history that we would listen to from a patient and suspect that perhaps this patient could be suffering from lactose intolerance. And after we've listened to this history, then we shall undertake a physical examination. During this physical examination, we want to do what we call especially palpating. As we palpate the abdomen, we use our hands to palpate, to touch the abdomen. And as we touch the abdomen, we shall feel there will be tenderness on the abdomen, of course. And when it is tapped onto, the kind of sound that it produces, it is a resonant kind of sound. And when we listen to using the stethoscope, then the kind of sound that is produced, the abdominal sound that is produced, the sounds that is produced, again, will help us know that there's a lot of gas within the abdomen, and therefore we can suspect that this person is suffering from lactose intolerance. Okay. Now, after this history, physical examination, then we want to do laboratory tests. The laboratory tests that can be taken include one that we call hydrogen breath test. In hydrogen breath test, under normal circumstances, one is not supposed to produce a lot of hydrogen through the air that they are exhaling. Okay, but when we ask a person who has lactose intolerance, when the lactose has not been digested well, there is a lot of hydrogen. So if this person is asked to breathe through a balloon that can measure the level of hydrogen that is being produced or being exhaled, the levels are so high. Okay, so we can again, after we've done this test of hydrogen breath test, we can realize that there's a lot of hydrogen in the exhaled air, and then suspect or come to a conclusion that they are suffering from lactose intolerance. Secondly, one can be given a test that we call lactose tolerance test. In lactose tolerance test, it means that a particular amount or a measured amount of lactose is given out to a patient, okay? And after a while, maybe 2 hours, we want to test the level of glucose that is within the blood or circulating within the bloodstream, okay? We took maybe a glucose test or a blood glucose test before we administered the milk, okay, or the lactose containing fluid, okay. So after the patient has taken this fluid or milk, then we want after 2 hours to test the amount of glucose that is circulating in the blood. If the amount is low, it means that this glucose is, if it is lower than expected, it means that this glucose was not absorbed into the circulation. Okay, because we said that lactose is broken down into galactose and glucose. So if there's no glucose after we have given somebody milk or lactose containing liquid, then it means it was not broken down. Okay, and the end result is that now there will be less glucose in the circulation. Okay, so lactose tolerance test is another test that can be done onto a person that is suffering from, that we are suspecting to be suffering from lactose intolerance. Another test that can be done is stool acidity test. Stool acidity test means that we collect a stool sample after we have administered a lactose containing meal or fluid or milk. Simply we say that we administer milk to a person, and then after they have taken the milk, we now collect a stool sample from them, expecting that it will not contain lactic acid. Okay? Yeah. If there is lactic acid in the stool, it means that lactose was not broken down. If it had been broken down, we could have gotten galactose and glucose. Now that it was not broken down, we are resulting with lactic acid in the stool. Okay? So those three tests are the tests that can be done onto a person who is suspected to be having lactose intolerance, together with the history and the physical examination. These three tests can help us conclude that one is suffering from lactose intolerance.
Okay.
Yeah.
So this is how basically we do
We
the
diagnose. That
Okay.
is how we diagnose.
Mtazamaji, tulikuwa tunaongea kuhusu ile kuchunguza ule ama uchunguzi wa kina zaidi wa kuweza kujua iwapo kama mgonjwa akona hii hali ya lactose intolerance, na tumeweza kuongea kuhusu mambo na physical examination ambapo tunakagua mwili wa mgonjwa moja kwa moja kutumia mikono yetu, kuangalia kwa tumbo, kubonyeza, kuangalia kama kuna tenderness. Tenderness ni uchungu. Kwa hivyo kushaona kwamba mgonjwa kuna uchungu, unajua tayari pia hiyo ni dalili moja ya kwamba kuna hiyo hali ya lactose intolerance. Tumezungumzia kuhusu hizo test ambazo nafanyiwa. Kuna hydrogen test na kuna lactose intolerance test pia ambayo inafanyiwa, na kuna ile stool acidity, kuangalia kiwango cha asidi katika choo kikubwa ili kujua kwamba kama kuna lactic acid, na kama iwapo kuna lactic acid tunajua kwamba basi ile lactose ambayo ilikuwa kwa maziwa ambayo ilikuwa yamenywewa haikuwa imevunjwa. Kwa hivyo uwe mgonjwa akona lactose intolerance.
Yeah.
Kwa hivyo daktari, kuna labda utuambie kama kuna tumeongea hii mambo yote, kama labda mtazamaji wetu anaweza jiuliza swali, je, kuna dawa yoyote ya hii hali ambayo ni lactose intolerance?
Well, basically, if we know the cause of the lactose intolerance or the diminished amount of lactase, we tackle the cause of the less, what is causing less lactase. If it is because of the diseases that we talked about, if we treated Crohn's disease or celiac disease, then we can resolve the problem. Okay. However, for us to manage a patient who is suffering from lactose intolerance, one, it means that we reduce the amount of lactose that they are consuming. We reduce the amount of lactose, the intake of milk and milk products is we reduce. We reduce that amount for us to manage this condition. Secondly, we need to be careful even as we want to reduce. As we want to reduce this, perhaps we go to purchase some products in the supermarkets or wherever shops that we go to buy. We need to be careful as to be checking onto the labels, because we don't want to submit to give a high level of lactose containing food to a patient who is suffering from lactose intolerance. So be careful as you purchase food from the shelves or from the markets, and therefore we reduce the amount that is being taken in. So similar again, we are advised to take food that is easy to digest. However much it may be containing lactose, we can use food that is easier to digest, and this include such things like fermented milk has already been worked on by the bacteria that cause fermentation. The yogurts that we can access, this one is recommended. It says that there is less lactose in goat's milk, and therefore we could recommend goat's milk for people suffering from this condition. Buttermilk and cheese are also less lactose because they have been again processed. Ice creams and milkshakes similarly have been processed and therefore contain less lactose. There are also preparations where we have lactose-free milk, milk that has been deprived of lactose, and this one can be recommended for such like patients. This says also soy milk can also be taken by such like patients. However, viewers, what we need to remember is that together with the milk giving us this lactose, it also gives us calcium and it also gives us vitamin D that are necessary for the normal functioning of the body. And therefore, we need to remember that we need to have alternative sources for this calcium. If we are going to give this person meals that are devoid of milk, then it means we have to look for sources of calcium that are necessary for the bones and also vitamin D that is necessary also for the bones and normal cellular functioning. So these are supplements that can that contain calcium at high levels include broccoli that is also found in the market. We have leafy vegetables. They are also recommended for such like people as a source of calcium. Cereals that are fortified or enriched with calcium are also recommended. And I also talked of soy milk, and similarly oranges can give us a good source of calcium. But vitamin D can also be sourced from eggs, liver, yogurt, and bottom line is that should the condition be so worse, then we need to replenish the body or supply the body with lactase. Yes, this lactase, there are preparations. These preparations could be in capsular form or they could be in chewable tablet form. So this as you administer a product, a dairy product, or give milk to the patient, you need to remember to supplement with lactase, which
enzyme.
Can be the enzyme that is necessary for the breakdown of lactose. So this can be found either in capsular form or in tablet form that can be chewed as one takes the meal that has lactose. Okay, so basically that is how we handle patients who are suffering from this lactose intolerance.
Na mtazamaji, tunaendelea kuzungumzia kuhusu hiyo hali ya lactose intolerance, na tulikuwa tunaongea kuhusu matibabu ya hiyo hali, na daktari ameweza kuongea vitu kadha wa kadha, akisema kwamba kitu ya kwanza ambapo kitu ya kwanza ya kuweza kutibu hiyo hali ni kuhakikisha kwamba yule mgonjwa ameweza kupunguza kile kiwango cha lactose ambacho atakuwa anakula ama anakunywa, na pia pia kuangalia label. Wakienda kama kwa maduka hivi, kwa supermarket, kuna baadhi ya bidhaa ambazo ziko na lactose nyingi, kiwango cha juu sana. Kwa hivyo lazima huyo mgonjwa aangalie, awe makini sana asije akanunua hizo bidhaa ambazo ziko na lactose kiwango cha juu. Kwa hivyo, kwa sababu hiyo itamletea shida. Na pia tumeweza kuzungumzia kuhusu chakula ambacho kinakuwa rahisi sana kusagika. Kwa mfano kuna maziwa mala, ambayo maziwa fermented milk in English. Kuna pia maziwa ya mbuzi, na pia kuna yogurt, na pia kuna hizi ice cream na butter na cheese. Hizo ndo baadhi ya vyakula ambavyo viko rahisi sana kuwa digested. Pengine una kitu ya kuongezea daktari?
When you talked of fermented milk, I felt like laughing because a friend of mine was cracking a joke and he said that fermented milk, he was referring to fermented milk as rotten milk.
No.
Okay, it is not rotten.
It is not rotten
milk.
But it is a milk which has been acted upon by bacteria.
It is healthy.
It is healthy.
Yeah, it's not rotten.
It is very easy to be digested.
Yes.
Also we have lactose free milk. Kuna ile baadhi ya maziwa ambayo hayana lactose kabisa. Lactose imeondolewa, ile sukari imeondolewa. Kuna maziwa fulani huwa nayaonanga kwa TV, sitaki kuyataja. Hayo maziwa yanaweza kusaidia sana. Hayana lactose. Na pia tumeweza kuzungumzia kuhusu alternative sources. Huyo mgonjwa ambaye akona lactose intolerance, tukimnyima maziwa pia yako na faida nyingi katika mwili
kabisa.
Kwa hivyo tutaweza kumletea vyakula vingine ambavyo vinaweza vika replace
kabisa.
Vinaweza vika replace.
Remember viewers that for example this lactose intolerance can be suffered by somebody who's still growing. For example the young children, and now if they are suffering from this and they require calcium and vitamin D for their bone development, bones, teeth, development. It requires calcium, and you can attest to this that most of the growing up children are fed on milk. Now that we are not giving them milk because they are suffering from lactose intolerance, they need an alternative for calcium, as a source for calcium. And this can be found even in omena.
In omena,
okay,
exactly.
yeah. So omena, together with the other things that we have already mentioned, can be a source for calcium that is necessary for the bones. Okay, and vitamin D also. We talked of the sources of vitamin D. Yeah.
Kwa hivi mgonjwa kama huyu apewe vitu kama omena hivyo,
omena, yeah, exactly.
Mboga za majani,
exactly, yeah,
ili kuhakikisha kwamba zile vitamins hajapata kwa maziwa zinapatikana kwa hizo vyakula
vingine.
Kuna hiyo oranges, machungwa pia, vitu kama hivyo. Alafu pia umeongelea kitu ya mwisho kuhusu kuna hiyo enzyme yenyewe.
Exactly.
Kama hiyo lactose intolerance imekuwa very 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 serious, ama imekuwa to the extreme, basi inabidi huyo mgonjwa awe anapewa hiyo enzyme. Ya kwamba akikunywa maziwa nayo anakunywa hiyo enzyme, ili hiyo enzyme lactase yenyewe yende katekate hiyo sukari ya lactose, to prevent lactose intolerance. Kwa hivyo daktari, tumeongea kuhusu hiyo mambo yote, na swali nilikuwa nataka nikuulize, je, kuna njia labda kuepuka lactose intolerance?
Well, it is hard. It is hard to prevent lactose intolerance, because again, as we said, how can you avoid being an African? You just find yourself being an African.
You just find yourself there.
So if you are predisposed or at risk of suffering from lactose intolerance because of being an African, again, prematurity, unless something like prematurity, which again is it doesn't occur by people's liking.
Exactly.
Okay, prematurity just comes by, and therefore one is born premature and they are unable to produce lactase, and therefore they suffer from these things. So we are saying that for a person maybe who was born normal, and as they are advancing in age, they are experiencing this lactose intolerance, then they can avoid the lactose containing foods or dairy products specifically, or majorly milk. So the only way to prevent lactose intolerance is to avoid milk or or dairy products that contain lactose. Yeah, that's the only way. That's the only way. However, as I said, it may not be possible to prevent it totally. Yeah, because maybe you suffered from a disease and you have now to undergo surgery. It is hard for us to. It's hard. It's hard for us to avoid such, just in the attempt to prevent lactose intolerance. It is not preventable.
It is not preventable.
As much. Yeah. But once you have been diagnosed with it, you either need the supplements as you continue using the lactose containing meals, or you avoid it totally. You avoid lactose containing and look at the other alternative foods that can give you calcium and vitamin D. But remember, milk does not only give this. So again, you need to look at other components that are found in milk and look for the alternative sources.
Okay.
Yeah.
Naam, tunashukuru sana daktari kwa muda huu ambao tumekuwa nawe katika studio. Leo tumekuwa, kama vile mtazamaji ulivyoona, leo tumekuwa na mada nyingine, very interesting topic, na tunafurahi sana kujifundisha mengi kuhusu lactose intolerance. Na pengine labda uko na jambo la mwisho lolote ambalo ningeweza kuambia watazamaji wetu ambao wanatutazama?
Now, viewers, that is all we can talk about lactose intolerance for today. As you have already been told, if you have anything that you would want us to clarify, you are welcome to share with us, and we shall be getting back to you, even making a call. You can say that my daughter, we have been giving this advice to people that avoid some proteins, because maybe your child is suffering from an itchy skin, or and we suspect that it could be a particular food, especially a particular protein. We tell you maybe avoid meat, avoid milk. So these things are there in the society that we are living in. And should you be having such like a condition, please be free and contact us. We shall be able to talk about this. Together with the conditions that we discuss here, viewers, we are a station that that minds about your spiritual well-being as well as your physical well-being. So the health matters that we discuss are for the maintenance of our good health, the health of the body. But also, I want to encourage you to continue tuning into the other programs that now maintain your spiritual well-being.
Exactly, yeah,
Okay,
yeah.
so viewers, do not turn away from Heaven Bound TV. We look forward to seeing you again another time talking about a different thing.
Thank you. Asante sana. Na kwa watazamaji wetu tunawapenda sana. Tunashukuru kwa kuchukua muda wako kututazama, na kama vile daktari alivyosema, uwe unatazama Heaven Bound TV kila wakati. Kwa hivi nimekuwa host David Ngure pamoja na my friend here Levi Mkolwe, na nashukuru sana. Tukutane tena siku ya Jumatano saa kama hizi na wakati kama huu. Kwa hivyo we say good night and have a nice time.
Oh, when the saints go marching in, oh, when the saints go marching in, oh Lord, I want to be among the number. Oh, when the saints go marching in. Oh, when